Hello everyone, I am Dr. Shweta Verma, an orthopedic spine surgeon at Felix Hospital, Sector 137, Noida. Today I would like to share some of the common mistakes that we do in patients with spinal injuries. As we know, spinal injuries are a very important and cause of lot of burden to the society, because with increase in road traffic accidents, the problems that we are facing in spine are actually increasing by leaps and bounds. So each age group presents with a different set of problems. In elderly patients, the set of problems in spinal injury are separate. In young adult patients, the problem are a different, belong to a different category. And in young children also, spinal injuries, though rare, but still can be a lot of devastation. So, according to a rough estimate, around 40 to 80 persons per million are actually affected in spinal injuries, which accounts to around 2.5 to 5 lakh cases per year. So in young patients who are say around 30 to 50 years of age group, they are most commonly victims of road traffic accident. So most importantly, what precautions or what we can do best is that while driving we can keep the helmets and the seat belts on, because they restrain you in a proper way, so that your abnormal mobility in spine is reduced. Apart from that, helmet gives you a good protection towards your cervical spine injuries. Also, most importantly is avoid drunk driving. Even though sometimes after a bout of drinking you feel that you are quite conscious and you are able to drive your vehicle much safely, it is always better not to drive with even if you have taken a little bit of alcohol, because that can impair your cognitive functions. And thirdly is that always keep yourself fully concentrated on driving. You should never use a mobile phone while driving, because that also tends to divert your attention. So these are the problems that are commonly seen in young patients who have sustained a spinal injury. But in elderly patients who are quite osteoporotic, the mode of trauma might not be that significant. These patients are already very frail, agile, they are bedridden, and with a very poor bone quality. I mean to say that in these patients, the osteoporosis is a prominent problem, and they sustain fractures even with a small degree of fall. So elderly patients, it's always necessary that certain ergonomic changes are adopted while at home, I mean to say that at home there should not be any slippery or wet floor, because elderly patients tend to slip on that. And also doormats. Doormats, though look to be quite ergonomic, but slippery floor and a doormat can be a nuisance to these elderly patients, which can slip very easily. And apart from that, certain modifications at home, like once they use toilets or bathrooms, they should be quite near to the places that they are staying. The more they are able to walk, the lesser balance that they have, the increased chances that these people will sustain osteoporotic fractures. And if, God forbid, if it happens, it is important that the patient should not be manipulated by themselves. Always seek urgent medical care, because a spinal injury patient is further at risk to get deteriorating spinal injury if we are not handling them properly. So we should make sure that we seek urgent medical care and patients are rigidly immobilized, and then they are transported to a healthcare facility where they can be tackled as and when as necessary. And apart from that, the third and the less likely age group is children. These children also might sustain a spinal fracture, but most of the time there is something called SCIWORA, SCIWORA. These patients might have an injury, but they are not detected on X-rays or an MRI, because their bones are soft, the ligaments are flexible. However, certain changes should be kept in mind to avoid injuries in pediatric age group. Like they are very restless, they are playing in the garden or in a park where there are swings or slides, where again the probability of sustaining a fracture is quite high, and the children might not be able to tell you exactly what is the problem, where have they sustained a trauma. So keeping them well cared from sharp edges or uneven slides or swings will tend to protect you, the children, from occult injury. So the same rule applies to them also. If they have sustained a fracture, they should be brought in situ, without any manipulation and with rigid immobilization to the healthcare facility, where they will be further evaluated and managed accordingly. So these are some basic broad guidelines that might help us to identify and safely transport the person from site of injury to a healthcare facility, so that future probability of worsening of spinal cord functions does not happen. And if you have any questions on spinal cord injuries or spine related problems, you can contact me at Felix Hospital or also on the website of hospital, www.felixhospital.com. Thank you.